is garnered both in Nigeria and North America. Is the Chief Medical Director of Ajah-based Lagos State-based E-Medical Comprehensive Consult Hospital, where the emphasis is on revolutionizing disease control through the promotion of preventive healthcare practices. He is also the founder of the African Crusade for Health and Environment, ACHE, a Nigerian NGO dedicated to providing critical public health care and developmental intervention and strategies to the underserved sectors in Nigeria, as well as advancing advocacy for crucial clinical and public health reforms. Distinguished ladies and gentlemen, please join me as we welcome Dr. Dumebi Okafor. Doctor, you have the stage.
Thank you very much for that very generous introduction. Good afternoon, members of the ICSAN Executive Council here present, all protocol duly observed. Ladies and gentlemen, welcome to today's webinar, Preventive Healthcare Paradigm, the Royal Road. When I was asked to choose a topic, evolved to this because nothing is more important. No healthcare issue, no healthcare diagnosis, no healthcare, and what you do in the first place to prevent diseases and disability. So this was the choices. I'm happy with what we have here today because, as the chairman has said, we will try to do justice to this and try to illuminate why this is the best paradigm in healthcare delivery. The next slide, please. The introduction says it all. If you go through that quickly, it summarizes the talk we have today. We are trying to see how the healthcare has moved from the traditional reactive concept to a proactive one, especially in developed countries, where they have now begun to enjoy the reduction of disease burden in terms of both quality of life and care costs, because they have done a lot to institute the reduction of people presenting to the the acute care intervention centers because of very general universal application of vaccination screenings, lifestyle modifications, and then of course public health initiatives to help control disease occurrence and spread. And this especially in countries like Canada, where healthcare is fully covered. We'll see how this has completely changed the game for them there. And while this is an initiative that we need to take up here more seriously, both at the individual and at the public policy level. Next slide, please. There again is our title. Next slide, please. Again, the expectation usually is that when we talk about this, everybody wants to hear, what can I do? But I cannot help but think of issues like this from the policy level. And I think everybody has a public policy level. I think everybody has a role to play in that understanding. We are all active managers and stakeholders in our country, in our nation, Nigeria. And when we be called upon or be engaged by the universe itself to play any role in this regard that we may find ourselves in. So it's important to know that you're not just talking about yourself, but you're talking about how to change the game for the country at large in this respect. They say nobody knows nobody can really get where it's going unless they know where they're coming from. So I'll begin with a quick history of medicine itself, and we'll go from there. We say that medicine is the art and art of healing, and this is as old as time itself. From the very beginning, mankind practiced some form of healthcare delivery. You had your shamans, you have your native healers, and from the earliest times where there was no awareness at all of natural factors and natural or the germ theory of diseases. They will use natural forces around them, whether it's superstitions, religion, anything to cope with the threats that they always faced. And so you always had things like famines, floods, earthquakes. They were there from the beginning. And also man-made afflictions, wars, fights, poor sanitation leading to diseases like we've had our own share recently, like with the COVID pandemic. These are age-old situations that afflicted mankind. So it was always hard to cope with it, look for a means of dealing with it. And then eventually, as he improved his science, his awareness of the environment, he started using things like leaves and herbs and elixirs, and even the toxins from animals to deal with this. Not always perfect. Leeches to draw blood, was a big deal one time. But these were things that these were the limits of what he knew.
My apologies, doctor. Apologies to interrupt. A very quick ground rules. Let's keep our lines muted so we can hear ourselves clearly. And the good doctor, you have 20 minutes. We would like to give our members ample opportunity to ask you questions once you're through with the presentation. So you have 20 minutes, and we can all keep our questions and we can ask those questions on the back end. Let me quickly recognize we have as well with us Elder Oyedele Togunde, FCIS. Thank you very much for joining us. Doctor, you may please proceed.
Thank you so much. Next slide, please. And so, next slide. And so, as we continue to advance in awareness, scientific awareness, eventually it became clear by the end of the next slide, please. At the end of the Middle Ages, that through the work of people like Robert Koch, and Louis Pasteur, that disease was caused by germs and parasites, and not by witches and angry gods. And this would, of course, open up the golden age of medicine, when it was now possible to cope with such ancient scourges as Black Death, tuberculosis, and leprosy, and understand that they were caused by things you could prevent, not the fury of gods or the act of people trying to bewitch you. So this became especially clear when things like penicillin and insulin were discovered, and it became quite obvious. These are called the golden milestones of medicine. It became obvious that mankind can actually handle the medical challenges he has if he's good at preventing them, and that's by understanding them better. Eventually, this will become something that the public health policies and academic institutions, medical training institutions will take up, and it will become the major, in developed worlds, the major approach to healthcare. Like I said at the beginning, especially in our own parts in underdeveloped or developing parts like ours, this is still not the case, which is what we have in this talk today. Other people are doing a lot with preventive healthcare paradigm, because this is the way you reduce the burden of disease in the first place. There's almost nothing you cannot prevent, even cancers, the morbidities and the diseases and outcome from things like cardiovascular disease like hypertension, diabetes, high cholesterol, which are like strokes, heart attacks. Those things can be prevented, believe it or not. They shouldn't happen as much as they do. And they would almost not happen at all if the uptake is 100% of preventive healthcare practices. So public health policies should change, and also our personal approach should change. And this, in the areas where this has become the practice, they have seen a reduction, serious reduction, especially in such important maladies like childhood disease, measles, polio, smallpox. And in the case of smallpox, of course, this was eradicated in 1980, completely gone because of vaccination, as per the World Health Organization's declaration in that year. That was a major, significant milestone in human history, that a disease, a germ, can be eliminated completely from circulation because of proper vaccination practices. Next slide, please. You can actually move to the next one. Change the slide. Anyway, so the the idea became for us to develop these practices and implement them to the point where they can change the game for us. I will go to stanza 2. Next slide, please. You will see where the effect of a country like Canada, which is called a Tier 1 Human Development Index country. Canada is, I think, on the 8th position. We will try and review and see how, just to give us a perspective on how well this has changed the game for them compared to a Tier 4 country like Nigeria, where we still spend a lot of money out of pocket just to care for our healthcare problems, healthcare needs. In fact, I think it's about 15% is the estimated World Bank average for Nigeria of household expenditure being spent on medical bills, which is a universal, above 10% is a universal hallmark of a poor developmental status, which is where we are in Nigeria. So in Canada, like I said, their healthcare coverage is completely covered, and they are said to have a 5-point healthcare coverage system, which is, please, next slide. Next slide, please. On stanza 2, the next slide. So that is in Canada, a publicly administered, number one, it says to be publicly administered, meaning that it is operated on a non-for-profit basis by a government-appointed agency. So the government, creates a parastatal that administers this program very diligently. Number two is comprehensive. It covers all medical procedures and visits. You go to see a doctor, you go to the hospital, you want to do a knee transplant, you want to do a heart transplant, you don't pay a dime. It's also, number three, universal. Everybody's covered. As long as you are a resident of Canada or a citizen, you are covered. There are no preventive. It's not whose son you are, whose daughter you are, or whose mother you are. It's about every single person. Number four, it's accessible. There is no barrier to getting care. Nobody must stop you or ask you to pay money or anything. As soon as you come in for care, you receive it. And number five is portable. So anywhere you go in Canada, no matter where you come from, if you are from Lagos, for example, and you go to Kano, you should get proper covered care. It doesn't depend on which state you are from. So these are things that are very unique and completely alien to us here. But it explains why you have the improvement in care status that you have in Canada. And this is because in Canada, most of the funds are going to this healthcare system. Believe it or not, most of it goes into preventing healthcare practices. It consumes the bulk of the funds, which leads to the very good outcomes that they have. For example, life expectancy in Canada is 81.3 years. Average life expectancy, you expect somebody to live up to that age. For Nigeria, it's about 7 years, if you get there, if even. In Canada, they used to get about 90,000 measles cases a year before 1963. 1963 is when they started their universal vaccination program against measles. Today, the annual outbreak in Canada is less than 100. In Nigeria, we still post about 200,000 annually. And so you understand, you begin to see the pattern of the effects of preventive health care. Colorectal cancer, a very big problem to managing one right now in the hospital, is preventable by a simple stool test. Next slide, please. Slide 15, please. Just go to slide 15 to catch up. Slide 15. So it's a simple stool test, and if needed, you now go to do a colonoscopy. Very cheap things. But by the time you get to become a full-blown cancer, you are dealing with a terminal illness. The case I have here is stage 4. I'm meeting him at stage 4. The malignancy has spread to the liver. And that's a death sentence. And then at this point, it will cost the family all they have in an attempt to try to fight for life, which is a losing battle. You are up a creek without a paddle. And this is where we are in this country. It is very lamentable. The annual rate in 2024 for Canada, again, the colorectal cancer, because of their diet, is higher in the Western world, Western climes, higher there than here, but still, Canada has managed to reduce its case to about 25,000 a year. With about deaths on it, about 9,000. And the survival in 5 years in Canada is about 66%. Almost that means if you get 100 people with colorectal diagnosed, about 70 of them will be alive in 5 years because they caught it very early, you know. But in Nigeria here, where we don't have that much of this problem, the rate is said to be 3.7 per 100,000 people, you know. So that's like 17. And if you adjust it for our population, that's about 927 people a year. Yet out of this, only half is expected to be alive at the end of 1 year from diagnosis. This is to show you again the great body of tragedy and costs and loss that comes from not checking on these issues on time, which is a constant, you know, problematic gap here, vacuum we have in this country. The heart rate we all hear about people dropping there at the party, they fell down at the office, they fell down, they slept and didn't wake up. Most of those for the adults in their middle age, from heart attack, not even stroke, but heart attack. The heart suddenly stops. And the same comparative data is present for Canada and Nigeria, where we have much reduction in the risk factors over there, whereas here they are completely not controlled, and they afflict their damage, you know, upon people without any interventions whatsoever. Nobody slows this down or stops it from happening. So we go on to standard 3. What can we do to implement some of these things and change the game for us? That is slide 18. Well, the benefit is a lot, you know. Like I said, you know, the where I always start from is the public health level. And so good sanitation, potable water supply, this slide 19 now, potable water supply, effective drainage systems, you know, the open body, we see our gutters open, you know, stagnant water open, you know, those things ought to be corrected. Water should be potable and clean, and also the weeds and, you know, debris that, you know, litters our homes, the cleaning of the home environment, reducing garbage and refuse is our number one things to control pests and rodents, and, you know, improve the bacterial load of our immediate environment towards reducing diseases. But if you go on to more active preventive healthcare paradigm, we can look at it from the point of view of age and gender-based, from a age and gender-based analysis, starting with children of both sexes, vaccination, making sure your children's vaccines are up to date. I tell my patients when they come here, send me this practice just started recently, but I make sure that everybody submits their children's vaccine status for review and updating, you know, because this is how you secure and fortify the child against very destructive childhood diseases, polio, things like polio, measles, rubella, pertussis, TB, which can have a great and very inimical effect on both the child and the family. And of course, the other things that are not necessarily borne by germs, but has to do with the developmental integrity of the child. So going to take the child to wellness clinics so they can measure the height and weight, check the eyesight, check the hearing, check the cognition, and ensure they have skills. They have skills for doing this, and ensure that the child is meeting their developmental milestones. This, which is important in things like autism, ADD, attention deficit disorder, dyslexia. You know, your child has a difficulty reading, you never know, causing frustration in school. But unless that is diagnosed and corrected on time, this will be a problem. Let's go to slide 21. For the adolescent group, it's the same thing, updating vaccination. And also, they are setting, as they begin to step into adulthood, they are setting measures you begin to take, setting boosted vaccinations, setting new vaccines that begin in that age, like the HPV, human papillomavirus vaccine, that helps female children to prevent, to actually preclude cervical cancer in the future. which they take these vaccines, they are very it's unlikely because the cancer is caused by a virus. They're unlikely to get cervical cancer in the future, which is a big scourge for women all over the world. So this again is something that needs to be done. Vaccinating the adolescent age children, sex education, and also continued monitoring of their growth and biological progress. For adults, is also to get your vaccine boosters, things like tetanus, herpes. Slide. This is slide 22. Your vaccine boosters, but also chronic disease management. We've talked about things like diabetes and high cholesterol, high blood pressure. These things should be measured and checked. Blood tests, clinical measurements, and where. So the chairman was saying at the beginning that the doctor, something about the doctor, we try to say let's avoid it. No, but actually the truth is that you must see your doctor. That's the whole point of this paradigm. The doctor is your friend, high on the list, above your pastor even. Your thing with God is with God directly. The doctor is the next person as it used to be in this country, because you should fall sick is the whole point. And the doctor holds that position to help you plan the things you do that will make you not be sick at all. So by the time you have fallen sick and you think you need a doctor, both of you have failed because you're now unwell. The idea, the paradigm is not to be sick at all. And it's so poor in this country, people cannot even, a lady would rather go and buy hair for 300,000 naira and not spend 15,000 to do her pap smear. Spend 20,000 naira to do your mammogram. It's so bad. Whereas when that disease finally catches up with you, God forbid, you will spend millions and still won't get anywhere. So it's as bad as this. There are things we do on a regular basis. Pap smear, for example, for a lady who's been sexually active and is in her reproductive age, should be almost every year for the first 3 years. And then eventually you can spread out if it's been normal to 2 yearly. So that to every 2 years, so that you now are able to catch anything. Because diseases actually, believe it or not, including cancers, can be treated. Oh, cancer cannot be treated. That's not true. That's the Nigerian version of cancer. Cancers are treated every day because they catch them early. You eliminate them, you take them off. If you see a beginning of a lesion, a cancer lesion on a woman's mammogram, you do your simple excision. That woman is free for life. So the severity of this presentation is a function of time, of late presentation, not of the disease itself. These can be managed if they are caught at the very beginning. So for women, screening for mammogram, with mammogram, cervical screening, ovarian cancer screening, blood checks for your cholesterol level, your blood sugar level, checking your hypertension regularly, and the same thing for men to check these blood test parameters, and also to do your prostate check, especially when you have a family history of these problems. Do your prostate check. Do your colonoscopy for actually both sexes. Colonoscopy should be your stool test for colon cancer. Colonoscopy should be almost every 5 years. At least 5 years, 5 yearly, so that you can catch colon cancer. And what is happening to my patient that I have on admission right now will not happen to us, where by the time you see it, the cancer has spread and has become effectively incurable and therefore terminal. Very bad news for everybody. So it's important to check on these things, no matter what it costs. Our problem here is the problem of cost, finance. We know, but it's better, I keep saying, to put your money where your health is. Because, like the secretary said, health is wealth. Everything you have boils down to, are you healthy enough to be a participant in that wealth that you have in the first place? If you are gone, it gets dispersed and all for nothing. So we should try, while we are trying to pray for and working to improve our country, move it forward to the point where we can care properly for its citizens, its children. We try as much as possible to change our own approach to preventive healthcare practices. And for the elderly people, nobody's too old under the preventive healthcare paradigm. Everybody needs, it's still life. You see how we protect it. So they have cancer screening to be done, like we mentioned. They have specific viruses that are due for the elderly, things like pneumovax for pneumonia because they get it easily. And then, of course, herpes zoster for shingles, things that come up at that age. Then you also have to assess them cognitively for things like Alzheimer's. Are they seeing properly, which can be adjusted for? Are they hearing well, which should be adjusted for? And of course, please, slide 24. There are things we can always do, all do.
My apologies, doctor. This is injury time already, so we should be wrapping it up.
Wrapping up. There's something we can all do, everybody, children, exercising, regular, keeping active, keep eating healthy. Your food should follow a pattern where it's mainly vegetables and fruits, minimal carbohydrates, and even more minimal fat and meats. Healthy eating, what you call the DASH diet, that alone has an impact on your cholesterol and your hypertension even before you start needing medications. Your meals should be rich in micronutrients, which are the vitamins and minerals, vitamin D and calcium, especially for women, omega-3 for everybody, and iron-rich foods. Extremely important that we keep to this because this not only prevents diseases, but also helps us to cope with the ones that we have. It's important to know that preventive practices are primary, which is what we have just been discussing, primary and secondary, but there's also tertiary, where when the disease has occurred, there are still things we should do. A person that's had a stroke still needs to see the doctor regularly to prevent a bigger stroke. So those are tertiary preventions. The fact that something has happened does not mean that we should give up. There are still things we should do to keep the health sustained. Next slide, please, slide 26. We are rushing towards the end. So in conclusion, preventive healthcare paradigm is a much neglected but critically important part of healthcare delivery in Nigeria. Strategies to prevent and detect the onset of healthcare dislocations, save resources, improve quality of life, and reduce the care cost burden on individuals and their families and the state. The individual is extremely wise to strive to implement these as much as possible, in spite of the considerable strain on the domestic budget from healthcare tariffs. For it's only by so doing that we can remain firmly on that gilded highway between health and happiness, the Royal Road. Thank you.
Fantastic. Thank you very much indeed, Dr. Dumebi Okafor. Let's give Dr. Dumebi Okafor our electronic hand claps. Thank you very much indeed. Fantastic.
I've not done enough. So much to talk about this, but what can we do? We only have 20 minutes.
We can imagine, but we do need to manage time. I mean, yes, thank you. I can see the claps coming in. Thank you, everyone.
Thank you.
To summarize, regular exercise, eating healthy, periodic health screening, and that's the way to the Royal Road in terms of preventive healthcare. I'm sure our members have a lot of questions, but before we get to that, let me quickly acknowledge the presence with us, Mr. Olufemi Shoka, our immediate past chairman, Legacy Chapter. Thank you for joining us. Chief Adewale Adeniji, thank you for joining us as well. Mr. Hame Folojiji, thank you very much for joining us. We will now take questions. I'm sure we have questions. Let's indicate by raising our hands, and we will give you the floor to ask your questions. But before then, I also have a few questions, so I might just get started with them. Doctor, may I suggest that you just take note of all the questions and you can answer them, all in one fell swoop, just to manage time as well.
All right.
Now, you mentioned that, please feel free to raise your hands if you have questions. I'll just hold the floor for you while you're putting together your questions. You mentioned that life expectancy in Canada is around 81, and in Nigeria, you said it's circa 56, thereabouts. I think that's for males. Is there any science to this, or is it just access to healthcare that's driving this huge gap between the life expectancy in Nigeria and those in tier 1 countries like Canada? My first question. Second question, So there's this popular saying that, people tend to believe that if you don't know you have an ailment, it doesn't start to kill you, and they'll tell you that it's when people get tested and they know of certain ailments that they start to die. So some people like to live in that ignorance and say ignorance is bliss. If I don't know about it, it doesn't kill me. Is there, and it does actually sort of play out with some people. It's the minute that they know about it, that the symptoms begin to manifest and all of those. Is there any science to this? Finally, there is this trend that we had back then, where parents would routinely administer arguably preventive medicine. Those days we had those 7 days medicines, to prevent malaria. Where do you draw the line between that sort of preventive healthcare as we knew it back then and self-medication, which obviously you medical practitioners don't advocate for? So
Thank
you
you.
could just take note of that. Let's please come
The
up with our
absolutely.
questions and the doctor will take all of them together.
Yeah.
Questions, please indicate by raising your hands and we'll give you the floor. Yes, our council member, Mrs. Jacqueline Odiadi, please go ahead.
Thank you, Doctor. Thank you, Lagos State Chapter. My chair, Lady Efosewere, and your team, well done for this program. My question, I just want to inquire about possibility of a handshake between the Nigerians in the diaspora and Lagos State Chapter. I know that some faith-based organizations, organize Nigerian doctors and healthcare providers on a yearly basis to come and embark on some outreach. Also know for a fact that Lagos State Chapter, we usually have a yearly conference, and looking at a possibility where we can have, since we have a doctor with the listening ear for our course, Dr. Dumebi Okafor, where we can come and have like a program on a yearly basis on wellness during one of our major programs or as a standalone program. So it's been enlightening, and especially these days where we have to multitask and do a lot of things to get by in the challenging economic environment. So health and wellness is always a front burner issue. So if there is a possibility of a handshake or a collaboration on a yearly basis, this will be most welcome. Thank you.
Thank you very much indeed, ma'am. Just to mention, you could also type your questions in the chat box and we'll take them if you don't want to speak. But please feel free to raise your hands and we'll give you the floor to ask your questions. Doctor, please take note of the questions. We'll answer them all together to manage time. The floor is still open. Questions.
I think for time efficiency, while they are doing that, while they are talking, I can actually begin to take this one, so it saves time, right?
Okay.
So after they can quickly add any other accumulated. Well, thank you. Very good questions. Very extremely good questions. Life expectancy being 81 versus Nigerian 67. It's about that's what the Human Developmental Index all about. Improvement. These improvements are because of all the three areas of the HDI, and it's very, very illuminating. Education. How educated are the people? How much education do they get at the end of their adult academic period? Quality of life, standard of living, access to clean, comfortable amenities and, food that is nutritious. All those things are going to be standard of living is improved. And of course, health, in which is measured in that geometric metric by life expectancy. How long are you expected to live? So these things come from an environment where everything is across board is up to standard, which Canada and first world countries are. But also, what we are seeing is that the preventive healthcare element is one of the biggest things. Because if you are eating well, the good example is obesity in America, where they don't really do a lot of healthcare insurance, public healthcare coverage, as in Canada. It's just like, I keep saying America is just, an overgrown Nigeria. Same thing we have is what we have there. There are a lot of people who are going around without any healthcare, believe it or not. So you find out there's a lot of obesity. The use of obesity are rampant there because nobody is curtailing it, controlling it. So even though you are prosperous, your prosperity becomes a curse because you are eating wrongly and nobody is stopping you. So the healthcare paradigm, the preventive healthcare paradigm is because if you come and say you're coming for your preventive healthcare, they check your weight and they check your height. That simple thing shows your BMI, whether you're off, and then they begin to tell you to reduce your weight into the healthy BMI range. That alone will save your life. It probably will add 10 years to your lifespan because you have reduced obesity. So simple measures like that is what creates and makes the difference. You talked about your second question. You said it was the means of, sorry, what was that issue? Your second one, the way I recorded the tested means to manifestation. The second question, Secretary.
Oh, okay. I think you've taken the first on the life index. Second was self-medication. Where do you draw a line between
That was the third one.
So yes, this statement that if you don't know about that you have an ailment, it doesn't start to kill you, and it has actually played out with some people.
Excellent. First of all, there's something in medicine we call the placebo effect. The mind is very powerful. If I gave you chalk now, if you have a back pain, and I shaped chalk like a pill, and I brought out a fancy looking bottle, and told you this is from Canada, it's for back pain, it makes it go, I give you, your back pain will disappear. So it doesn't mean that what caused your back pain is still not there, but because of the powerful placebo effect of the mind, it would make your pain relieve for a while before it comes back again. The same thing happens in the case of awareness. So what you're saying is quite true. Most cancer patients don't begin to deteriorate until they know their diagnosis. But that's the physical deterioration. It is because they now have added the emotional toil to the problem that makes them go down, because they are now dealing with the fact that I may be dying soon. Even if it wasn't cancer, if somebody tells you you have a death sentence, you have an execution date, you're not going to do well. So that is why you see that happening. But it doesn't change the biological progression of that disease. It will still kill the person when it's due. The physical manifestations are not the issue. So whereas the mind is very powerful, not being aware will cause the disease to progress. You won't be aware and it's still going on. It doesn't save any time. It doesn't save you in any way. So it's still eminently important to be, aware early, to give yourself a fighting chance. Because what we're talking about is not catching it midway or close to the end. It's at the beginning when it is not likely to. So when you're seeing a doctor with that kind of situation, he's telling you, we're going to get rid of this. So the talk will not be there. It is the people who come in when it's really bad. They were not aware. They were blissfully thriving in ignorance. They are now here that they have a short time to live that gives them that effect, which is the emotional impact. But the target of this paradigm is not to get to that point at all. So by the time you are hearing about it, you are dealing, especially when you are dealing with a doctor who knows what he's doing. He will really sit you down to explain this properly, which doctors should always do, to let you know that this is not a problem. We can get rid of it immediately, and that reduces the stress on you, emotional stress on you. Number 3, you were saying that the preventive care practice we used to practice in the olden days. Sorry, what was your exact question on that?
So I mentioned that, back then there was this Sunday medication that parents would administer. I believe must have been for malaria or something. Is there any validation for that, in terms of how you draw the line between self-medication and preventive healthcare?
Oh no. This is what I meant by vaccinations, and in the resource itself, you will see where it says chemical prophylaxis. That's what it means. It's a big deal abroad when if you have something that's rampant around you. One of the ways of dealing with it is by using medications. I'll give you an example. Since I used to have malaria, one of those who have malaria every single month when I was in Nigeria, and those days when I come and I am around. I failed to have it. There was a day, I think I told you about this. There was a day I had to be taken from the airport in Toronto by ambulance simply because of malaria, because I had lost my medication, the one I used on a flight from Lagos to Benin. I lost it. I didn't even bother to get another one. That trip, going back home, by the middle of the trip, I was already very sick. At the end of the day, I called an ambulance. So now, since I take my Sunday medicine every Sunday unfailingly, I have not had malaria in 2 years. So it's part of what we tell people to do. If there's a problem you need to get rid of that's rampant in the environment, you have to take your prophylaxis regularly. A very common practice in the developed part of the world that I'm telling you. So it is not self-medication. It is the paradigm, right? It's the royal road that you are on when you are doing that. So it's extremely important. Of course, all healthcare practice should be directed by your physician. And once that is established, your duty now is to keep on that road. That's what I meant by being on the royal road. You stay on the road. You don't wander into the bush. You stay on the path going forward, right? And so that is definitely part of it. And that's what I do as well. And then the handshake. You see, when I was saying, people thought I was joking. I said, my prayer is this, that people start thinking from the policy level. That's what she's doing. That's the question, that beautiful question Madam just asked. She's not thinking about herself, only thinking about everybody. And that's important for the Lagos chapter to consider. It's very easy. Annually, we set up a tent and we run everybody's preventive healthcare, whatever. And then they go on with their doctors. They get a clear prescription and go on with their doctors to see what they have to do. This can be pap smears can be done. Handheld ultrasounds can be used to check for ladies' breast marks if they are all within the age. And also blood tests and all that can be done with mobile equipment. Very easy. So, Madam, thank you very much for that question. It's extremely possible, especially as you have said, with collaboration between people outside and here because of financial considerations. It can be set up annually and we can do that. And it's an extremely laudable idea. Thank you.
Fantastic. Doctor, do you also want to touch on your telemedicine initiative where you have healthcare practitioners from Canada attend to patients in Nigeria?
Yes. So we are building this network where we have both local and Nigerian doctors who have a lot to offer. So local, international. So when you have a case, you see, it is extremely antiquated and backward to say, I want to go and see my doctor first. Then the traffic, then the tedium of the logistics, everything to get to see your doctor. Nowadays, you should sit in your house. And so the first part of seeing your physician can actually be by a clear teleconsultation. There's nothing wrong with that. Then you can now plan after that how to go. But at least it gives you peace of mind. It gives you clarity about what you have. You begin to know that you are either very sick or not sick, or you were just, most of the time it's actually just the mind playing tricks on you. So you want to really be able to clear that as soon as possible without going through traffic. So you call your doctor, we set it up, we talk with you. So you may also have a test result. And then they want you to, you want to understand more about it. You call us. You call doctors on telehealth. They review you and tell you. It could be in your bedroom, and this happens. Those days are gone when you must carry yourself and go first before you get quality healthcare opinion. So that's what we're.
Fantastic. We have some questions in the chat box. Olushola Deniro is asking, the rising cases of cancer is becoming like a pandemic across the globe. What could be the reason for the surge in cancer cases that is prevalent in children and adults now?
The rising case of?
The rising cases of cancer is becoming like a pandemic across the globe. What could be the reason for the surge in cancer cases that is prevalent in children and adults now? And she's saying a friend lost her 4-year-old daughter to the cancer of the kidney recently. So sorry to hear that. That's question one. There's another question. This is Shegun Adeomi, FCIS, our council member. Good day, doctor. In Nigeria, the cost of access to medical facilities occasioned by unfortunate economic crunch on the part of Nigerians has become a big challenge to wellness. As a consequence, this has made the greater majority of Nigerians to resort to unorthodox measures, such as AGBO, as an alternative to the orthodox measures. What measures can be put in place to address this challenge? Doctor, over to you.
Right. So I'll take that first one. I'm not sure if she's saying rising the rate of cancer in Nigeria, or is she saying globally?
She's saying across the globe.
Across the globe, okay.
From like a pandemic.
Yeah, so there's something in statistics, with the population statistics that we say the rectangularization of population. So before you have this, it was a triangle where the younger people are at the bottom, and then you have, as you go up, becomes more and more of a triangle that narrows down to those that are elderly. That was the profile of population. But now it's getting rectangular, where as much people are alive when they are old as young. And this is caused by the improving qualities of care in the modern society. But the opposite effect is also prevalent, where because the standard of living is becoming also standardized, you begin to see the rectangularization of diseases in all the groups of the population, like cancer in children. This is mostly, the studies are showing health style, lifestyle related. So apart from the fact that you have better measures to actually detect diseases and diagnose them, so things that have always been there, like the main body of the iceberg below the surface of the water, now becomes clear as the iceberg rises or the water reduces. The water of ignorance and darkness reduces. You now know that they are there, where they've always been there. But also, yes, the actual occurrence prevalence is increasing because we are beginning to adopt similar lifestyle across the globe, where we have these high fatty diets. We are more sedentary. There's less fiber. There's more sugar in our diets and all that. So it's mostly a dietary and lifestyle issue, where the things that promote high sugar content, for example, very, very promotive to development of such things. Whereas you have natural tendencies to something like your colon cancer can be transmitted as an inherited trait. Some breast cancers, the estrogen positive ones, can be transmitted, But even for them, the factors that now tilt you into that negative balance are in your lifestyle. Take colon cancer, for example. You eat we now have a richer meat diet. Before, the native Nigerian it was mostly fish. You see goat for Christmas, you are lucky. But now everybody eats meat copiously. At the same time, the fiber in our diet is reducing. So even if you think you are moving your bowels normally, but most of it stay longer than it should in transit in the GI, the nitrites from the meat is quite irritating to the GI column, mucosa, the lining of the GI, where the cancer comes from. Cancer is basically a product of irritation, something irritating a tissue for so long, causes the cell to transform to something else. So if you have that, and you have a lifestyle that now led you to retain products in your body longer than it should, you are promoting colon cancer. And that's why we see colon cancer higher abroad than here. So even if there's a natural capacity to develop it, the triggers are becoming more potent, causing it to happen more because of the lifestyle standardization across the globe. They were native, anthropologically traditional population that did their own thing separately. They eat their fiber, eat their natural foods, nothing processed. But now, because of global commerce, everything is becoming the same. That's why you see this increase, this rectangularization of disease incidences across the globe as well. We are becoming more like them, and less like what we used to be. So next question.
Before you leave that point, doctor, because I'm just reading her message again. 4-year-old cancer of the kidney. It's a bit drastic. Is there any hereditary angle to such cancers?
Yeah, one thing we have to understand, I mean, it's for the lay person is quite disturbing. But the truth of the matter is that even from, I can remember from when I was in medical school, when I was studying, you have children have been having cancer from the beginning of time. You just wouldn't know about it because of maybe information or unless it impacts you directly. But it has been a very regular thing from retinoblastomas, a child born with the eye swollen, or that quickly begins to develop swelling of the eye because the retina is forming a tumor, to like the kidney ones you are saying, a lot of things. So that's why you have hospitals in developing countries that are dedicated to just childhood carcinomas, as you have in Toronto. So it's not rare, it's not new. The rate could increase. You can say the rate increase for the reasons but it's not at all novel. It's something diseases are very comprehensive. In this environment, that's why I shake my head when I see everything is malaria and typhoid. Are you kidding? Human pathology is as thick as this. So the human pathology catalog, there are a lot of things that we experience, and that's where my talk started. Mankind has always been faced with a lot of maladies, a lot, covering all the range of experience. So it is not true that these are new. Again, I join you in sympathizing with those who have this problem, our prayers with them. But it is very common, very rampant, even in developing countries. We have the hospital for sick children in Toronto. Their biggest department is the cancer section. So it's not a new thing at all. It's very dramatic and very heartbroken. But children develop cancer because that's what cancer is. Cancer is not really something that is anybody's fault. It's just like I said, triggers can make it more the rate to increase, to more prevalent. But cancer is just the body's cell going rogue, just goes off on its own. Like anything else, just stroke of luck, of ill luck. It happens and the cell goes out of control and begins to grow without being controlled by the normal cellular monitors that control tissue development, and it just goes rogue and begins like a rebel or a terrorist group, in the community. They just go into the bush and start doing their thing. So that's how it is. It happens spontaneously, and it happens across all ages from the beginning of time. It may be surprising or shocking to the lay people, but us in medicine, from the time we started training, we see cases of this as a very common phenomenon.
Fantastic. Thank you very much, Doctor. Would you like me to read the next question again? So there was a second question, not sure if you got it. It says, "Good day, Doctor. In Nigeria, the cost of access to medical facilities occasioned by unfortunate economic crunch on the part of Nigerians has become a big challenge to wellness. As a consequence, this has made the greater majority of Nigerians to resort to unorthodox measures such as Agbo as an alternative to the orthodox measures. What measures can be put in place to address this challenge?" Just hold on a minute. There's another question. Is there medical proof that green tea could help prevent cancer?
Okay. I'll take both questions.
There's another
comment. So the first question is, again, very good question.
Go
Sorry?
Ahead. Go ahead.
Yeah, very good questions. The first one is the general lamentation that we all have. I started with that lamentation. It is about the economic situation and what can we do? Policy has to change. The government investment in the well-being of the citizens, because really these things are publicly funded for it to be very effective. The governmental resources has to be used. Like I said in Nigeria, they are publicly funded. Tax funds are used to drive this because you cannot, and that's what I said, that a measure of underdevelopment is how much each person is spending from his pockets, from the pocket of the household to care for health. That's a very backward society, which is what we have here. It is wrong and it's immoral, but that's our reality. And unless it changes from the top, there's nothing the individual can do. What I am asking for the individual to do is to look squarely at this and make a conscious choice to spend more on their health than on material things, on fleeting things. It has to be that we spend more. We consciously adopt this concept, this spirit, if you will, and practice it to the point where we actually, because that's all we are left to do. It is not safe to move to, and which is a big deal here now. People go to the babalawos and go to the churches and continuously ruin their chances at survival because of this. I had a gentleman here that was, was yesterday or 2 days ago, that was so impressed with what I had done with him. He came and told me about the problem with the wife and how the wife had a cesarean section before. And because they were now more religious, when they told them that the next child should be given birth to by cesarean section, because she has a contracted, nothing you can do about it. The pelvis is contracted. The passage, we say, is about the passenger and the passage. If passenger is too big or the passage is too small, there's nothing you can do. You have to section that woman. And they told them. And the pastor says, not under his watch, not as far as God is in heaven. And they started praying for this woman at home and doing all kinds of things. And of course, that baby died. In fact, I said the miracle is that the woman didn't die. And as the man himself said, it's at the end of the day, we have to do DCS now for a dead baby, so that the woman herself will not die. At the end of the day, a complete waste of everybody's time, a dead baby into the bargain. So this is the outcome of these very, very ignorant options we take for healthcare. It is better for us to spend money on the proper health delivery measures and processes than to be going into these areas that are only just, they give us that temporary relief from, say, we're not spending too much, but they have all this highfalutin reputation. They did, but it's not true. Some people will get well because they would have gotten well anyway, because their situation is not too bad. And there are certain areas that are very good, like the bone setting people, they do a good job because it's just bone anyway, apart from the significant pain they used to inflict their care. Whereas if you're in a proper healthcare center, we'll give you anesthesia before we do all that. So it is extremely wrong, and it's just a product of our situation that we end up in a situation where people run to the pastors and to the native centers for things that should not. If you were to do a study of how much people die in those centers, you know what you're talking about. The outcome is never good. And so it's never the right way to go. But it's a measure of, is a reflection of how dire the quagmire we find ourselves in this country, which nobody seems to have. I mean, money, is the end of the game. Nobody seems to have a solution to. But I see a lot of times individually, people could have, if not for the pull, the momentum of the bad practice of going in that direction, people could have helped themselves. But instead, they resort to flowing in that direction, whereas they had the means. They could have chosen to sell a car or sell a land or sell a house, an extra house, to take care of themselves properly and sustain life instead of going around and, chasing shadows, So green tea is anything that's not studied under proper controlled studies. A doctor cannot, a scientist cannot really give a clear response to that. Our what we use, our practices are based on things that are actually properly studied, controlled, large case studies, and then we are able to give scientific conclusions. But the thing with green tea is that it contains a lot of antioxidants, and it's a physiological fact that antioxidants help to control and curtail a lot of these problems that will come up later in life. Heart attacks, the cancers, because your body in the course of metabolism produces antioxidants. They're like radicals that go around damaging cells. And so if you can control them, you can reduce them, you have a good chance of helping yourself in the long run. How much of impact this has in actually reducing, disease outcome is, subject to formal, scientific studies, which we don't have at the present time. But I think it's a good practice to inculcate. Thank you.
Thank you, Doctor. We have one final question, Mr. Shemadeu, FCIS.
The high incidences of kidney failures is threatening, and the cost of weekly dialysis is alarming. We are indeed gladdened when the President Ahmed Tinubu announced the discounted price from 50,000 to 12,000 a few days ago. Doctor, what are the exact causes of kidney failure and how do we avoid this?
Your panel of people asking questions are just people after my own heart. They are asking me the right questions, and this is the sum total of what we are saying. This is the best example of what preventive healthcare, the kidney. This person that asked this question, God bless you. The kidney is the end point for a lot of diseases. It's the end point for diabetes, kidney damage, end point for hypertension, kidney damage, end point for even cholesterol, kidney damage, because it's such a complex organ that the small vessels that it used to work, the microcapillary that it used to work, are damaged by these things. The reason why you have high kidney is because these diseases are rampant. The kidney itself has its own bona fide disease that it has, but there are very few. Glomerular nephropathies are very few. Most of the times, because of other things are damaging it. The toxins in your water you are taking, the toxins in your food, on a chronic ongoing basis. And by the time it has happened, it is too late. Kidney damage is one of the biggest things we try to avoid with diabetes. Apart from damage to the nerves that leads to your gangrene in your leg and your eyes, your blindness. But kidney damage in hypertension. That's why the best medications are the ones that are directed also to protecting the kidney. Nephroprotective effects. So the kidney is a big deal because it's used to filter waste. Majority of waste is filtered, apart from the ones that are altered by the liver and thrown into the stool to be excreted. The kidney is the major waste excretion center in the body. So how much you throw at it and how much you treat it ends up showing up in such end stage problems like dialysis. This is what we are saying, that unless we actually, we have this bad cultural practice where it's when the person comes in failure that you begin to look for a dialysis center. But those things that should be put in place, so dialysis centers are not near in the first place, is what we are talking about today. It is happening because there's no preventive health care. There will always be kidney problems because, like I said, the kidney has its own problems that just have been issued even in children. But that's only a small slice of the case with kidney problems in a country, in a society like our own, because most of it is caused by end-stage damage from other chronic diseases that were not controlled in the first place. Number one is hypertension, and number two is diabetes. So this again is the point of it all. That until we are ready to start preventing problems from occurring first, whereby the doctor, the health center should be your biggest friend. People should go to see the doctor because they don't want to be sick, not because they are sick, which is a wrong paradigm here. Oh, I don't have to go to the hospital. They'll say, you go, say, no, I'm not sick now. No, I shake my head. No. You go to your doctor regularly because that's the only way you stop yourself from falling sick. Because the days, like they say in Benin, the days that have not come are more than the ones that have come already. So you want to make sure that your days are long and well in this land of the living. That's why you put your effort and your resources into maintaining, sustaining that status quo. Not until the hammer has dropped, you now start running around helter-skelter and dragging everybody with you. So yes, the kidney situation, dialysis situation is an exact manifestation of what we are talking about today. The poverty of the preventive healthcare paradigm in Nigeria. Thank you.
Fantastic. Thank you very much indeed, Dr. Kappa.
You're welcome.
If you leave here with nothing else, please hold on to this as a takeaway. Do ensure to see your doctor, and I'm just citing from doctor's last statement. Do ensure to see your doctor because you don't want to be sick and not because you are already sick. And that's the preventive healthcare paradigm, the Royal Road very much indeed. Thank you very much, Dr. Okafor.
Thank you all.
We know that in Canada, they probably pay doctors per hour, and you agreed to do this pro bono. Thank you very much indeed. We really,
Okay.
truly appreciate it. May I
Thank you.
please call on our honorary secretary, Chief Adewale Adeliji, to give us the vote of thanks. Chief? Chief, you're muted. You're muted.
Thanks for that. Thanks, Temidayo. On behalf of ICFAN Lagos State Chapter Chair, Efosa Ewere FCRS, and all members of the Executive Committee, I'd like to thank our resource person, Dr. Dumebi Okafor, for this very helpful and enlightening session. The Lord bless you, sir. We've really been blessed and edified. I also recognize and thank all council members present, our leaders and members of ICFAN, for taking time out of their very busy schedule to be with us at this health and wellness webinar. It is our hope, like Temidayo just said, that we have all taken learnings from this webinar and our lives will be the better for it. So I would like to say thank you for coming. See you all at all other institute programs, especially the Lagos State Chapter Annual General Meeting coming up on the 20th of March 2025 via Zoom. God bless you all. Thank you so much.
Thank you very
Thank you.
much indeed, Chief. It's International Women's Day tomorrow. Happy International Women's Day to all our women.
Yes, happy.
Very much indeed. Madam Chair?
Thank you so much, my Social Secretary and Honorary Secretary, for your comments, your closing comments. And I want to sincerely, from the bottom of my heart, thank Dr. Dumebi Okafor for sharing his time with us. Like the Social Secretary said, we can't pay for your time, but you've given us very valuable insights to preventive health care.
Yeah.
And we are very happy that we had you on board. And I'm very sure and confident that everyone who has joined in today had a very insightful session. Thank you. And thank you once again to everyone who joined in. We sincerely appreciate your time.
Thank you.
Thank you very much, Madam Chair. Thank you, everyone. If you do need any further advice from the good doctor, you can get in touch with the Lagos State Chapter executives and we will connect you to him. Thank you very much, everyone, and have a fantastic weekend.
Thank you.
Thank you. Thank you, everyone.
Take care. Bye.